Kristen in KPTM wants to know if clarify the rules for bars in Douglas County. Can they sit at bar tops? The answer is yes. And under phase 3, they will be able to consume food at those bar tops as well. So all the other rules will be applying, but no food right now. Starting June 22nd, yes to food.
Becca with NET has a couple of questions. One is, have groups other than Test Nebraska been reducing the number of tests they've been doing, and do we know why, if that's the case?
Becca, NETV wants to know, have groups other than Test Nebraska been reducing the amount of testing they've been doing, and if so, why? And the answer is yes. Providers, for example, have been doing less testing, even as Test Nebraska has been doing more testing. And I imagine it's just if you look at the number of cases we have and our hospitalizations, we're just seeing fewer of those. And so I imagine it's tied to fewer people coming in with the symptoms or the exposures that they think that they have coronavirus, and so there's just fewer tests being done.
She also wants to know, since Test Nebraska will have verified testing information on long-term care facilities, do we expect to start reporting facility-specific information on coronavirus for those facilities?
So Becca wants to know, also, since Test Nebraska is going to be doing testing on long-term care facilities, will we start releasing testing information on long-term care facilities, and that is not part of the plan right now.
The Dakota County Star says that some local officials don't want to follow the state's eligibility guidelines for CARES Act money, and wonders if you have any comment on that.
So the Dakota County Star says some local officials don't want to follow the guidelines with regard to eligibility for CARES Act money. And do I have any comment on that? And it really is, it's their option. If they don't want to follow the guidelines, they won't be eligible for the CARES Act money, but that's certainly their, prerogative to do that.
That's all I got for now.
All right, that's all we got for now. So questions from folks in here? I know we covered a lot. Paul.
Can you clarify the rules on restaurants? Is there still going to be a 6-foot distance when you get to 100%?
So the question was from Paul, clarifying rules on restaurants. Will there still be a 6-foot distance between tables when we go to 100% occupancy? Yes, that will be in the guidance, though. It will not be in the DHM. It will not be the violation of the, a misdemeanor violation. But yes, that will be in the guidance document for those restaurants.
Those guidance, you're not sure when that's going to take effect.
So the guidance documents that we will put out, we'll put out in conjunction with the DHMs. So again, what we're doing, a lot of times what we're doing, Paul, is taking things out of the DHM where it's a violation of law and putting it into the guidance as we loosen these restrictions. We still think it's a good idea. We're just not making it a misdemeanor violation.
So I got to ask the football question.
Football question, okay.
100%, doesn't that open the door to having a full stadium at Memorial?
So the question was, if you go to 100% occupancy for outdoor venues, doesn't that open it up to a full football stadium? Maximum 10,000 capacity. So no, it would not be a full football stadium at this point. However, even with this, we're still expecting venues to manage this around social distancing, and they still have to go to their local public health director and get a plan signed off on before they can actually be in operation. So so this is not actually a green light for a full football stadium at Memorial Stadium yet. We all hope we can get to a football season, but this is not it right now.
And can you just comment overall on why you're doing this now? I mean, there was some concern that Memorial Weekend we're going to see a spike of people getting together. What are you seeing? Why relax these DHMs?
So Paul's question is why relax the DHMs, and basically because the data supports it. So our public dashboard, go take a look at it. If you go look, for example, at our case data, you'll see it. It's a nice bell curve, and we're on the downhill slide. If you go look at the hospital tab, you'll see the same thing with regard to hospitalizations, a nice curve going down. We probably have got the fewest amount of hospitalizations statewide that we've had since the first week of May. So again, the data shows that we can start loosening these restrictions. And again, we want to continue to monitor this, but that's why we're making the decision to go forward with the announcement for June 22nd. All right, Paul, I'm cutting you off because we got to go to somebody else. We'll come back to you if we run out of questions. Brandon.
Just for clarification, so it was 10 people at one point, and it was 25, and is now there's no number as long as you're within that occupancy percentage? Is that?
Yeah, so Brendan's question was, it was 10 people, then it was 25 people, now it's occupancy ratings. Yes, that's correct. So there is no 10-person rule starting, 25-person rule starting June 22nd. It will all relate back to occupancy ratings for those venues.
Bill Shammer wants to know, there were several rules in place about dugout distancing, bleachers, snacks, regarding sports. Do those still apply in phase 3?
So Bill Shammer wants to know about the rules with regard to dugouts, concessions, snacks. Felicia, we're moving that all into guidance, is that correct?
Well, it's already in guidance.
It's already in guidance and it remains in guidance.
Yep, and we'll adjust make some small adjustments.
And there'll be some small adjustments to that. So I'd refer you to the guidance document that comes out, but that'll still be in the guidance documents.
Steve White wants to know, the Central District is seeing 5 or fewer new cases a day. If that continues, how quickly can Grand Island go to phase 3?
So Steve White with NTV wants to know, gee, with Central District being at single digits, like 5 or fewer for the last couple of weeks, how quickly can they catch up with the rest of the state? I continue to have conversations with Mayor Steele and Teresa Anderson about this. We just talked Friday, for example, and we'll continue to work with the local public health department and Mayor Steele with regard to when they feel like we can move that on. But it's an ongoing conversation. Fred?
What's the soonest families can visit their relatives in a nursing home, and do the nursing home residents and staff have to be tested?
So the question was, when's the soonest a family member will be able to visit their loved one in a nursing home facility, and do the staff and the residents have to be tested? To move into phase 3, the staff have to be tested. We're recommending that the residents be tested. And Felicia, I'm going to have you come up and answer the first part of that question and just give a little bit more detail about when someone can expect to be able to visit a loved one in a long-term care facility.
Hi, so really it's going to depend on where that facility is located, and if they've had, they've completed the testing and the different criteria. But as long as their local health district is in phase 3, so starting June 22nd would be the earliest. And then they've had the testing for all their staff has been completed. They're not really seeing any positives, things like that. And they have a couple other criteria that have been met, then they can start reopening for visitation for their family members.
And the residents don't have to be tested?
Residents are not required to be tested. It's recommended, but really, they don't have to be tested. So we want to keep kind of keep that open for facilities and kind of what's in the best interest of their residents.
Just for clarity, Felicia, you want to talk about what happens if somebody does test positive in one of those facilities, either staff or resident?
Yeah, so if somebody does test positive, whether it's a staff member or a resident, then they'll work with the local health department, and likely the ICAP team will also come in and kind of help assess where they're at. We'll work on the contact tracing and then determine if additional testing is needed at the facility, and just if, depending on the situation, the exposure level, all of those different things, then it may be determined that they have to go back to phase 1. Or
no visitors.
Which means no visitors, or they could stay at their current phase if they're able to meet isolation requirements.
So is phase 2 what they're in now, and that's only in dire circumstances?
Yeah, so it's compassionate care, or if there's psychosocial, like if it's in the best interest of the patient's mental health for visitation.
That's phase 2, where most of the state is right now.
Yep,
And who determines that?
the facility, and in the best interest of the patient. They know their patients, they know their residents, and what's in their best interest.
Thank you, Felicia. Yeah, Lee.
Just kind of following up on Paul's question. In regards to why now, you mentioned that the hospital data is representing that this is the optimal time. Why is it now, not the end of the month when we see the restrictions on phase 2 was supposed to expire? Why only 14, 15 days after the first or the second DHM went in place?
Yeah, so typically, again, what we've been using is using that kind of 2-week time frame to kind of measure when new cases and new hospitalizations are coming along. That's what we kind of did through all the month of May. And so this is what we're doing in June as well. And so we loosened restrictions June 1st. It's June 15th now. We're actually making the announcement for June 22nd, so it'll be actually 3 weeks. So we're taking this a step at a time based upon the incubation period for the virus. And if we don't see, again, a lot more activity, which we actually have seen declining activity, we feel comfortable with loosening up those restrictions another step.
You've kept Douglas County within phase 3. Is the hospital data supporting the Douglas County also going into phase 3?
So the question was, is the hospital data also supporting Douglas County going to phase 3? And the answer is yes. I believe today, as of today, we had about 97 people in Douglas County hospitals. If you go back and look a couple of weeks ago, it was like 130 some people in the hospital in Douglas County, so they've also been on the downward swing. Yeah.
I know you look at hospital data for like determining who goes into phase 2, who goes into phase 3, but have you considered all having hundreds if not thousands of people together, you know, when they're out protesting the last couple of weeks?
So the question was, what about the protesters? There were thousands of people protesting. Did that play into your consideration? We believe that we've got the testing capacity to be able to test folks. And again, the whole way this generally works in epidemiology is that you test to find the person who's infected, you get them isolated, keep them away from the rest of the public so they don't infect anybody else, and then you do the contact tracing to be able to go out and find the folks who were in touch with that infected person and get them to quarantine or monitor their symptoms if it wasn't a close contact. And so we've got the ability to be able to do that now through things like Test Nebraska. We have over 750 contact tracers now trained to be able to get on top of anything and do robust contact tracing. So we've got the resources to be able to do that. So we are obviously going to continue to monitor this very closely with regard to what happened with the protests. It is a cause for concern, but we feel that we've got the capacity to be able to handle it.
Dakota County started a follow-up question. They want it is similar to the first one, but they want to know why we're requiring counties like Dakota County that have a high rate of coronavirus results to reopen or not receive federal funding.
So Dakota County Star wants to know, why is Dakota County required to take some of the steps we've asked for example, make sure your county courthouse is open to serve the public, when they've had a lot of cases. And actually, if you go back and look over the last several weeks, Dakota County has been in single digit, sometimes 0 cases on a daily basis. So really, we aren't seeing more cases in Dakota County.
We also have a request from Rebecca at NET to get an update from Dr. Anton on the number of long-term care and need processing cases.
Dr. Anton, can you up and share with the numbers on long-term care and food processing, please?
I'll start with long-term care numbers for today. There have been 131 long-term care facilities with either a positive staff member or resident affected by COVID-19. There's 560 residents that are COVID positive in those facilities, and 451 staff members. Deaths are at 99 now, with 1 still pending validation. So those are the long-term care facilities.
Do you have the data for the last 2 weeks?
I do. So the governor's asking, and we are keeping track now for the last 2 weeks. I think the most glaring thing is that we have not had a validated death in the last 2 weeks in any of the long-term care facilities. And we've had 39 residents test positive in the last 2 weeks, with 14 facilities either having a staff member or a resident test positive. So I think it's getting somewhat better as far as long-term care facilities are concerned. Before I leave long-term care facilities, I do want to also thank Dr. Ashraf, who's sitting in the audience today, for all his help. I don't know how we'd be as good as we are, as well as we're doing. The governor mentioned last week that Nebraska ranks 11th best in the country as far as the number of residents in long-term care facilities per 1,000 residents testing positive. And we rank 13th best in the United States as far as long-term care facility deaths per 1,000 residents. So again, it's all due to, again, Felicia also and all the team we have. I mean, we don't like to see anything happen in long-term care facilities, but it just gives you an idea about where we stand from a national standpoint. The meat processing plants haven't really changed a whole lot since we reported it last week. We have 4,071 confirmed cases of workers in the meat packing industry and 15 deaths and 173 hospitalizations in the meat processing plants. Again, the governor was mentioning about Dakota, Grand Island, Lexington area. It seems like once that area gets over the initial phase, the initial surge, they've really settled down quite quickly. And as a matter of fact, Grand Island Hospital today, St. Francis, again, which used to report up to 30, 40, even up to 50 positive cases, is down to 4 cases now, with only 1 of those cases in the ICU and nobody even on a ventilator anymore. So fairly good numbers overall.
Thank you, Dr. Antone. And that, just that point, yeah, single digits or zero in many of those counties where we had the food processing plants, Saline, Colfax, Platte, Dakota, Adams, Dodge, or not Dodge. Dodge has been low single or low double digits, but pretty close. Yeah.
I just want to clarify, so everything in phase 3 on these 2 pages, it's all still in the DHM. But when we get to phase 4, that's when we'll see more guidance come out?
So the things we laid out there are, for Phase 3, are in the DHM with the guidance for some things like the 6-foot distancing between tables. And then the plan is, broadly speaking, to move that in Phase 4 from the DHM into guidance. So yes, that's broadly speaking. The one exception to that is gatherings. Indoor gatherings are going from 25 to 50% in Phase 3, and outdoor gatherings are going up to 75% in Phase 3. In Phase 4, indoor gatherings will go to 75%, outdoor gatherings will go to 100%. Yeah, Brandon.
So on the handout, it says that contact team sports are allowed July 1st, just my understanding, so that's football, soccer, wrestling.
Right.
And
So starting July 1st, contact sports, football, basketball, all those contact sports will be allowed to have games and practices starting July 1st. The decision was, again, just taking a look at loosening restrictions a step at a time. We had prohibited those in the month of June. We're allowing them now in the month of July.
Beckett M&T wants to know, Dakota and Hall counties have slowed the spread enough to reopen their courthouses. Why are they not moving to phase 3 now?
So Becca wants to know if, if they've slowed in, say, Central District Public Health in Dakota, if they slowed enough to single digits, which they have, why aren't they moving just straight into phase 3 again? We're taking this a step at a time. So it's a step at a time for everybody. It's going to be a step at a time for the Central District, Hall County, Dakota County. Other questions? Paul?
Just to clarify, on the nursing homes, do they have to test before they can move to open visitation, or do they have to have a plan to test?
So the question is, they actually have to test. The staff, this complete testing for staff to be able to move into phase 3 and allow those visitations.
And can you give me an update? You said, you got the capacity to test now. What is Test Nebraska doing per day now?
I don't have the numbers. We've got, on Test Nebraska right offhand, I don't know if Dr. Antone has, we've got the capacity. When we're in Omaha and Lincoln, Paul, we've got the scheduled slots for 3,000 tests a day, and we've got the lab capacity to do over 3,000 tests a day. Now, obviously, this week, I announced all those other cities. When we're in our small rural towns, we're not going to get to that same kind of capacity just because there's just fewer people. But when we're in Omaha and Lincoln, we can do 3,000 tests a day.
How many days have you done 3,000 tests a day?
Have we hit 3,000 tests a day yet? I know we've had the scheduled slots.
2,400 and something was, I think, the largest.
I think the largest so far has been 2,400.
Last week, the average was 1,625 per day.
The average last week was 1,625 per day. And again, this is why we need people to get signed up. And one of the issues we run into also is when we sign up people for Test Nebraska, we've got scheduling slots. We found, I think, about a 15% rate of people not showing up. So that also takes us down. We don't want to promise a slot to somebody who doesn't show up, but then we have people who don't show up.
And time for a couple last questions.
Can you comment on this New Yorker story that came out this week? It was a long story, but one of the issues that was raised was the use of the extractor that's being used is normally used for plants and animals, not for humans. But that coupled with the level detection could explain why they have much lower positivity rates with these Test Nebraska programs.
So the question was about a New Yorker story. I have not read that story, Paul, but here's the deal. We have a CLIAS approved lab that has verified the equipment. University of Nebraska has verified the equipment with us. We validated it. We're quite confident in our results.
Last question.
What is the positivity rate now?
Positivity rate for Test Nebraska, a little over 4%?
Right at 4%.
Right at 4%.
How's that compared to the other lab?
How does that compare to the other labs that are people coming into the hospital who we know are sick? How does that compare?
Public health lab always has a little bit higher positivity rate, closer to maybe 9 to 10%.
Okay.
Overall, statewide, we've been below 10% for the last several weeks.
Yeah, I was going to say, so statewide, broadly speaking, we've been below 10% for the last couple of weeks. Nebraska Public Health Lab is closer to 9% public testing. Yeah.
11, 12%.
Yeah.
So basically, you don't have any concerns about
I do.
positivity rates?
I do not have any concerns about low positivity rates with Test Nebraska.
Media went through the lab a couple weeks ago when Paul was out.
Oh, meeting went through the lab a couple weeks ago when you were on, you weren't here, Paul. So, all right. Any other last minute questions? Seeing none, thank you again, folks, for coming here to be able to get the update. We've got a lot of news here today. I know it was a lot to digest. Mike, thanks for coming here for Dairy Month. And appreciate, Felicia, you and the commissioner coming to talk about what we're doing with regard to long-term care facilities and schools. Folks, again, please remember to continue to do social distancing so that we continue to slow the spread in our state and continue to loosen restrictions. Thank you all very much, and have a great day.